Thank you. Thank you, dear Chair, for accepting the change of law. Excuse me, I have changed the two presentations because it would be good to start with the history, then just come to the recent methodology. So this is the history, and I have to thank Professor Luc, who had inspired us for many years, and particularly with this bone scanning methodology for diagnostic purposes. Yes. I know that many of my colleagues are here and know about Human Rights Foundation, but for the ones who don't know enough, Human Rights Foundation of Turkey had been established in 1990, and it had been 26 years now, a long time on this field. We are providing treatment and rehabilitation for torture survivors, but there are some few forensic physicians like myself, and we are trying to document human rights violations. And thanks to IRCT just having a short session for forensics and opening a space for us to present our work also. And we had started with alternative medical legal reports, actually not after the establishment of Human Rights Foundation, but before the establishment, actually. For example, we had many cases in those years, and unfortunately we couldn't examine them immediately. They were examined by medical doctors who were falsifying the findings, covering all the torture findings in those years, in 1980s, after the military coup in 1980. And many of the medical doctors didn't use any methods, any just improved advanced methods in this sense. And in Izmir Center of Human Rights Foundation, they had just reviewed the reports and the reasons for the medical doctors why they didn't just display the medical findings for these kinds of cases, and what were the reasons for their covering of torture findings. And they observed that security forces are usually in the examination room themselves, just oppressing the medical doctors. Examination was not sufficient because many of these medical doctors were general practitioners, not experienced in medical legal cases, and the reports didn't reflect torture. They were scared of the authority and from the police, of course. Security forces influenced many of the medical doctors because they were inexperienced in many cases. But some of these medical doctors, unfortunately, just elaborated deliberately false negative reports, although some of them lack of knowledge. So we started to discuss how we can use advanced methodology for just discovering torture findings after weeks, after months, or years in many cases. And Professor Luc, as an orthopedic surgeon, frequently used bone scanning and just considered that it could be very useful, particularly for cases with bone injuries not amounting to fractures, but only bruises in the bone. So he started to use scintigraphy for this purpose. And the first alternative forensic medicine report was just 1 year before the establishment of Human Rights Foundation. It was elaborated in the name of Izmir Medical Association, Human Rights Committee. So they worked with the case, and after 2 days, 24 days and 14 days of torture. They had the follow-ups for this case, together with the bone scanning process. And as you can see, there were just the increased activity on the bones where they were bruised, actually. But of course, the National Court didn't accept this alternative medical legal report in that years. However, the case applied to the European Court of Human Rights, and European Court of Human Rights considered the alternative medical legal report, and the result was successful on behalf of this case. Then there were many cases, of course, in Izmir Center of Human Rights Foundation this time, with the cases of all bone scannings and also X-rays for these cases. In this case, you can see the fracture. There is a tiny fracture on the bone. And also, there are no fractures on the other parts of the foot, but there are the activities, increased activities on the other parts where there are no fractures at all. So it was very useful. Another case with severe beatings, and he had activities, increased activities on the ribs, and also he had testicular torsion, squeezing of the scrotum, and there was the increased activity again with these cases. And we continued working with these cases and having bone scans just to compare in some of them. Of course, having the consent of the cases. So there are many of them having the increased activities due to beatings, blunt trauma, and I have to remark about torture in Turkey. In many discussions after 2000, there were some remarks telling that Turkey doesn't practice torture anymore. But you can see the years, it is 2007, 2009, and there are severe beatings. Yes, there was torture, always torture systematically existed in Turkey. However, sometimes the places has changed, and mostly outside on the streets during demonstrations, they just deprived from liberty, they surrounded people and beat in the middle of these surrounded place, but out on the street. So people considered that this is not torture. This is excessive use of force. But it is not excessive use of force because they were deprived of their liberty and they were intently beaten just in the middle of the street. And it was also a kind of just showing people these beatings, so that the people, the community was scared of being beaten and didn't attend to any kind of peaceful demonstrations afterwards. So it had a reason, it had an intention, and we could all call them as torture. So there are more cases again. As you can notice, there are the tibia fracture is noticed here on MRI, and not only the tibia fracture, but also there are increased activities on the upper part of the body as well. We had follow-ups. For example, one case just continued for rehabilitation, and we had bone scans after 10 years and 11 years. It was very useful in the beginning. After the coup attempt, not coup attempt, it is something totally different, some different story. After the military coup, he was just arrested and tortured in 1981. And after 10 years, we had this increased activity. And after 12 years, there was again the increased activity. And he just visited the foundation center in 2004 and 2011. We still had the increased activity, but of course it was just less intense in these cases. So we started to consider whether we can evaluate all these cases, review the cases, and just discuss them together. Already Professor Luc had a publication in 1991, and afterwards our colleague Mirzai had a publication in 1998. And we just reviewed the cases of Istanbul Center, and we published the Istanbul Center cases in 2013. And this one, now I will just shortly summarize, has been published this year in the Journal of Legal Medicine, our own journal in Turkey. Unfortunately, it is Turkish, so we thought that maybe it would be good to share it in English as well, because you wouldn't be able to read it in Turkish. So we reviewed cases from 1991 to 2012, and during that period, more than 13,000 cases had been recorded, and we had 475 bone scans among these 13,000 cases. We just didn't include 60 of these cases due to some systemic diseases such as osteomyelitis, tuberculosis, cancer, etc., which also has increased activity. So we excluded them, and we reviewed 415 of these according to sex, age, torture methods, and most importantly, time since torture and duration of exposure to torture was the parts that we just tried to understand the intensity of the activity. Most of the cases, more than 80%, were males. Usually males are mostly arrested. They are more in the streets and in the political activities, so they are mostly subject to torture. The mean age was 30, and when we consider the presentations before, it is similar actually. These are young adults, these people who are tortured in most of the countries. And 232 of them, 56% of them, had traumatic hyperactivity. We also just checked where they have been born and whether there was a discrimination among these torture survivors according to the places that they were born. For example, there was a peak among people who had been born in Diyarbakir. So Kurdish people are discriminated and mostly are subject to torture. And also you see another peak in, it is yurt dışı, unfortunately. I couldn't change it, it was in Turkish. And it was a picture, so I couldn't manage to change the graphic afterwards. It is international, other countries. They are born in other countries. Why? Because after military coup, people just migrated. They were refugees on different countries, but their children afterwards came to Turkey. Although they were born in other countries, they came to Turkey and attended to political activities, just following their family tradition. So it is also another peak in this sense. When you check the years, there is an increase in the slope in the years of 1990s. So it is also important for the armed clashes in between the Kurdish militants and Turkish military forces. And there was a huge oppression and forced displacements in the villages of Kurdish region. So it fits with the political process as well. How long were they detained and tortured? When we check it, the mean day was 22. But between 1991 to 2000, the mean was 35 days, and it extended even to 240 days. So 240 days they were detained and tortured. Between 2000 and 2010, the mean was 7 days, and it extended up to 14 days in state of emergency. When we check the cases with long period of detention and long exposure of torture, we just see the picture that the hyperactivity is increased among people who had been exposed to torture for longer times. And it is positive in 81% of these cases. So it is important that for longer periods of torture, then the trauma, the intensity of trauma, and the positive findings of bone scanning should be expected for such kind of cases. And we checked when they came and examined and how we could have the bone scanning. And when we consider the cases, again, when the time is longer, the long-term cases have less positive findings of bone scanning. So if we just can examine them earlier, then there are more positive findings with such cases. Yes, there are several examples, starting from the long period to shorter period, 14 months later, 8 months later. You can see the injuries and the hyperactivity of the ribs, for example. Again, 8 months later, 6 months later, 4 months later. These are all the cases from all centers of Human Rights Foundation, the 5 centers of Human Rights Foundation. 53 days later, you can see the hyperactivity in the right knee. 39 days later, again, you can see the hyperactivity on the sternum and the costal parts. 38 days later, it is again ribs due to beatings, severe beatings. Beating, cross-suspension, electrical shocks, and phalange torture together on the ankle and the second rib. 18 days later, so we are coming just with the shorter terms. After 5 days, of course, it is not very easy for these people to just come immediately after being released from detention. Usually they are scared. But some of the cases can just be courage enough to come and be examined. So we could have such cases. Of course, we had limitations for this study because we didn't have a control group. We tried our best. In the university, we just had some discussion with the nuclear medicine department if we could just evaluate the cases after informing and getting the consent from the cases, but couldn't manage. Hopefully we will have the comparison, but this is a limitation. We didn't have follow-ups, enough cases follow-ups. So we need a prospective study for this purpose. But we can say that, of course, it is highly sensitive, this diagnostic method, so we can use it, but it is not too specific, of course, because there are many other reasons causing this increased activity on the bones. We have to exclude them, and it needs a long period. Of course, we have a comprehensive and holistic view for these cases, so we collect all the data, we have all the examination findings and all the history, so we have the evidence. But sometimes, if you do not have enough evidence, then it is difficult to distinguish in between another systemic disease or trauma. But we recommend it to confirm particularly the testimony of torture, if there are no other means. So I want to thank you for your patience with all these cases. There were too many findings. Of course, I tried to be very quick. Okay, thank you.